Good evening. It's great to see so many people interested in the world that we inhabit, pretty much 24 hours a day, 7 days a week. The questions that I was asked to address reflect some of the issues that came up in the slides. So, do hospitals really have influence over spending? Have senates made a difference in terms of clinical priorities? And sadly, I could answer those questions very quickly, and then I thought actually what's more important is perhaps to give you a little glimpse in our world. So the funding hasn't significantly changed. We're an organisation that has about £500 million income every year. Just broadly for your information, about a third of that is for specialised services, trauma, renal transplantation, neurosurgery, things like that. And the other 2/3 come from the clinical commissioning groups like Martin's, Bristol, South Gloucestershire and some of North Somerset for us. So has the funding changed significantly since the reforms? I'm probably pleased to say not radically. But part of me is pleased about that, but part of me thinks actually it does need to change significantly for the reasons that Martin's talked about, which is actually that patients want different services. And if we're going to meet some of those challenges of the future, around chronic disease, and also we're going to meet the needs of people's busy lives. I think they're increasingly not going to want to come to outpatients appointments, whether or not you can park, or spend a long time in hospital. And it's important that the expertise that we have in the hospital can actually meet people's needs in different ways in the future. I was also going to say a little bit about why has funding not significantly changed, and just to explain a little bit about the funding system. So for good reasons, I think, prior to this set of reforms, we have a system called payment by results, which basically means that hospitals are paid for every time a patient arrives, requires an outpatient appointment, a scan, a blood test, an operation, turns up at an emergency department, that costs £60 to Martin's Group, a hip operation, £6,000 if it's a second hip operation, nearer to £9,000 or £10,000. So you can see, these are big sums of money that are costed up, that go into a contract, and that we agree with the clinical commissioning groups every year. And in fact, partly because of an ageing population, and partly because I'm pleased to say that hospitals like mine and like our sister hospital in Bristol, we can do more things now. We can help people live longer. We can intervene at the edge, at some fantastic innovative ways. And it's really great that people in Bristol and beyond are able to access all of that care in this city. But they do cost a lot of money, and I think that's why it's quite difficult for the clinical commissioning groups to really make big changes in the way money moves around the health and social care system. And it's quite clear we do not have enough money in the system at the moment to meet the needs of a frail, ageing elderly population, in particular patients who want to stay at home and live their last few years comfortably at home, but with the right support and care. So in terms of efficiency, so I think everybody agrees that hospitals like ours and university hospitals, Bristol, have been making 4% efficiency every year. That means although we're getting an increasing number of patients coming through the doors, actually we're expected every year to treat more patients for less money. And that's a national request of all hospitals, that we have to provide 4% more work for the same amount of money. And I think everybody agrees, all the commentators agree, that actually the NHS will not survive by continuing to do that every year. We've been doing that for 3 years in Bristol, and although I believe there are more efficiencies to be derived, particularly for us, we've moved into a new hospital, we've got lots of opportunity to become much slicker and much more technologically advanced. Actually, there'll come a limit where you can just keep getting more and more efficient. And then in order to meet I think, the budgetary allocation that we get, we're going to have to do much more radical things in healthcare. I'm up for radical change. That's what I like to do and have tried to do in many parts of my NHS career. But let me just explain to you the complexity of making change in the health and social care system that my trust operates in. Requires 3 clinical commissioning groups, 3 local authorities, NHS England, Health Watch, 3 community provider organisations like district nurses, all to be in the same room together to make a decision that we're going to make a significant change. And that's really, really difficult. That's not because anybody intended it to be like that, but that is the reality of the reforms as Andrew Lansley designed them. And that doesn't include Care Quality Commission, Trust Development Authority, that's one of our regulators, Health Watch, or indeed the public and people and patients who use our services, who are really the most important people who we need to listen to. So to make change happen in the kind of scale that we need in Bristol requires all those parties to work together. And I suppose my overwhelming message is, having worked for far too long, probably not far too long, but for a long time in the NHS and in every part of the NHS, as David said, my experience, my view is actually it's important that Martin and colleagues that work with Martin and I are very bold, and we step outside our structures and we take some big decisions for this city. And no national politician is going to stop us from taking big decisions, providing we're doing the right things for patients. And there's a great opportunity in this region for all of those people to get together and to design some really innovative ways of providing healthcare. But we have got to work together, and we have got to be brave and bold. And I'm going to leave you with some of the things that I'm pleased to say my predecessors, and maybe Martin was here then as well, but he looks a bit young to have been here, but my predecessors had a Bristol Health Services plan, and here are some of the fantastic assets that Bristol has as a consequence. A children's hospital, fantastic children's hospital. People in this city region do not have to travel 50, 100, 200 miles. You've got a fantastic world-class children's hospital. This was Frenchay before we moved, and this lady didn't mind having her photograph taken because we've shown it lots of times. But these were the services we left behind only of May of this year. And this is the new asset, which belongs to the people of Bristol and beyond. This is a hospital that serves patients and the public. And we want it to be used properly for the right things, but we want it to meet the needs of people here, some of you sitting in the room and your families and beyond. And it's really important that we take some big decisions that actually match the innovation and the ambition that our predecessors had in developing a Bristol Health Services plan. So I hope I can leave you with some exciting thoughts. Thank you.